Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to Physician Heal Thyself, the podcast. I'm your host, Dr. Lara, and this is episode 27, guys. We are knocking them out of the way. In this episode, I want to talk about a couple things on nutrition, especially because the last couple episodes we've talked about food and diet and so forth. So in this conversation, I want to talk about the top 7 foods that you should avoid for better health. Now, I do want to give a disclosure. This is for educational purposes. Not that telling someone to not eat sugar is going to be a harmful thing. It's actually a good thing. But just keep in mind, this is for educational purposes only, and it's not intended to treat or provide medical guidance for anyone. Please speak to your doctor, and if your doctor is not able to help you with this, we'll talk about some ways that you can reach out to me and potentially work with me directly. So I want to disclose, I am a practicing physician. So all of these things that I'm telling you, these are exactly the same things that I tell all my patients. They may vary to some degree, but when I consult with patients, these are the things that I go through when we talk about nutrition and avoiding some of these foods that can be very detrimental to their health. Now, I always do provide a, specialized approach to each person, but I don't know any person that really does well with all of these foods. So let's go ahead and get started. These foods are either foods or food categories or additives that you definitely want to avoid. And I'll tell you all of them up front, and then we'll break it down into specifically why I recommend that you do not consume these. Sometimes I tell people to completely avoid them all, or reduce them in their diet. It just depends what kind of conditions, what are we working with. So those foods are sugar, dairy, gluten, soy, corn, nightshade foods, which is a category of foods, and we'll talk about those, and then MSG, also known as monosodium glutamate. And this is a food additive that you'll find in a lot of processed foods. So let's get into it. So the first one is sugar. Sugar has no nutritional value whatsoever. But what we do know and understand is that it causes a lot of inflammation, and it's so highly addictive. Do you know that sugar stimulates the same part of the brain that cocaine and any other drug does? So it's not uncommon that when I see patients, or I know of people who are, coming off of a drug that they've been, abusing over the years, what their next plan to do is they start to eat sugar. They start to eat a lot of candy and sweet things, because sugar is going to trigger a strong dopamine response in the brain. And this is what leads them to having those cravings. So even let's say that you don't have a history of drug abuse whatsoever, and you do have, however, a sugar addiction, which is a real thing. I had one before. And so usually when people are stressed, they go for something sweet because it elicits that dopamine response, and it makes us feel good. And the more of that dopamine hit that we get, we want more, and we want more. And before you know it, most of your diet consists of sugary foods, sugary drinks, things that make you feel better. They make you feel better for a short moment, but unfortunately, in the long run, it actually makes you feel worse. So, sugar, I tell all my patients, and people who are watching this episode who are my patients will tell you that I always say, sugar is always going to cause more inflammation and cause oxidative stress. And we're going to talk about what those two things are later on. So like I said, when a person's overstimulated with sugar, they're not going to want to eat vegetables. They're not going to even want to eat fruits. But as we wean people off of sugar, what I start to see is that their palate, their brain starts to neutralize, and then they're able to eat vegetables in their diet. They're able to eat more, fruits and other foods that are healthier for them. So foods that are, people who have a high sugar diet, this is going to lead to, excess glucose in the brain. And we know that too much sugar in the brain it's going to cause some degeneration there. And ultimately what that means, you're going to have memory and cognitive, deficiencies in the long run. So we know that sugar feeds cancer cells. It causes obviously diabetes and weight gain. So there's really no nutritional value when it comes to these refined sugars, these processed sugars that we find in processed foods, and we also find in sugary drinks. So I always tell my patients the easiest way to do this, even if you just start with this, is stop drinking sugary drinks. Now you can find replacements that don't affect your blood sugars like stevia or monk fruit. I often get asked about honey. And, honey, it's going to be in moderation, because if you're doing too much honey, it's still going to affect blood sugars, and it's going to still create some inflammation, although there's some other nutritional values with honey, right? Raw honey. The second food category that I tell people to eliminate or reduce, and people don't like me when I say this, it is cow dairy. Cow dairy causes a lot of inflammation for many conditions. And oftentimes I'll hear people say, oh, but I'm not lactose intolerant, I'm fine. Well, it's not just about, causing digestive issues. Yes, it's true. Some people who truly are lactose intolerant, drinking cow milk or eating cow, dairy products, it's going to cause, diarrhea or constipation in some people. And it can cause skin issues and so many other issues. But even people who don't think they have symptoms, when they remove all of the cow dairy out of their diet for, say, 2 or 3 weeks, and they have it again, now they're able to see what those effects are on them individually. So if you have eczema or psoriasis or any skin conditions, you're going to notice that if dairy is, something that you're sensitive to, it's going to irritate these conditions. So, if you have conditions where creating mucus is an issue, so asthma, any breathing problems, COPD, you really want to avoid dairy. It's just not going to make the situation any better. It creates more mucus, and the mucus becomes a little bit more viscous, so a little thicker, and it's not good for most of us. So we just avoid dairy when there's chronic conditions that we're working with. The next categories, I'm sure many of you hear these online and on social media, and this is gluten. Gluten is a protein that's been extracted from wheat, and there's two ways that we look at the problems with gluten. One is that because it's been extracted from wheat, it's also used in many processed foods. It's even used in skin products, and it's used because it helps with the texture of substances. And so we are so overexposed from gluten products that I believe that people have just developed a sensitivity from gluten, causing, allergic reactions or other symptoms from it. But also because it's coming from wheat, we know that a lot of our wheat products in this country are heavily sprayed, they're genetically modified. And so because of that, we believe that some of those things in gluten are also causing people to have adverse reactions to it. So gluten is a neurotoxin. And what that means that it is literally toxic to your brain. So while some people can have digestive issues with consuming gluten, right? Some people have neurological symptoms from it. So there's a condition called celiac disease. And people who have celiac disease, they truly have an allergic reaction to gluten, so to wheat products. They cannot eat it. Their gut is inflamed. It'll cause diarrhea, and in some it'll cause constipation, a lot of abdominal pain. So we want to avoid gluten when you truly are when you have celiac disease. But so many people have a gluten sensitivity, and they won't know until they clean up their diet. You need a clear slate, And when you introduce something that's gluten, you'll notice. Now, you can heal the gut so that your body isn't reacting to that. So I always tell people in the initial stages of working through cleaning up the diet, we will completely avoid these foods. But when you start to introduce, or you first want to heal the gut, right? And healing the gut is different for everyone. It can take months. It can take several years. I know I had a gluten sensitivity that I didn't know about until I cleared up my diet back in 2011. And what I noticed, any little thing that had gluten, I would have a migraine. My mood would change. I would become so antisocial and very depressed. And I would be so fatigued, I had to fall asleep. And so then I was moody and cranky for the rest, for the next day or two. And that was a neurotoxin effect on me. Now, as I eliminated these things completely, I started to heal my gut. And over time and over the years, what I notice now, if I have a piece of pizza that's not gluten-free, guess what? I don't react to it. But it did take several years for me to heal my gut. And this is the case for most people. It's eliminate the thing that's irritating the body, give the body what it needs to heal. As you continue, right, you have to continue to avoid these foods that are causing the destructive issue. And then over time, there may be some times that in moderation, you can have these foods. It can't be something that I can't eat pizza every day. I'll go back to having an issue with that. And so that's where I discuss things with my patients. So gluten can cause inflammation. It's terrible in autoimmune conditions. And if you have joint pain, it can definitely elicit a greater pain response for people with joint pain. The other two foods I'm going to kind of group together, and that's soy and corn. And the reason I want to group these two together is because we know that soy and corn in this country, in the United States, it is highly genetically modified. About 80% or so of soy and corn are genetically modified. And so there's a lot of adverse reactions that our bodies have from constant exposure to these foods. Also, these two foods, you're going to find that they are used as additives in so many processed foods and also beauty products. So that constant re-exposure of soy and corn and gluten over time, we develop a sensitivity to it. So with soy products that are genetically modified, especially people with autoimmune conditions, if they have a thyroid autoimmune condition like Hashimoto's thyroiditis or Graves' disease, I completely tell them, avoid soy like it's the devil. Just stay away from it. If you're gonna use beauty products, you have to look at the beauty products to make sure there's no soy derivatives in that product, because it's still entering the bloodstream. Our skin, it is an organ that detoxifies and absorbs, and it is the largest organ we have, and we oftentimes overlook the importance of our skin. So if we're not cautious about what we're putting on our skin, we could be exposing ourselves through those things that we're sensitive to, that's causing an allergic reaction or any kind of negative reactions in our body. So soy and corn, like I said, they're a no, especially for people who have a lot of chronic conditions. I hope you're enjoying this. Make sure you're taking notes. Go back, re-listen, take notes of these things, because it's very important to understand the why behind why you're not going to eat these foods so that you can be healthier. The next category is going to be the nightshade foods. Some people are familiar with these, some are not. Most of the people that I consult with for the first time in my office, they're just not familiar with what is a nightshade. So these foods, you can look them up online. There's tons of them, but you want to focus on the ones that are the highest in the category of containing what's called a lectin. So these are tomatoes, eggplants, peppers, white potatoes, legumes, peanuts, and whole grains. So these nightshade foods, like I said, they contain something called lectin, which it's a protein, and it binds to the carbohydrates, and it's this lectin that causes inflammation in the bodies of some people. I won't say all people, but some people. So these lectins, they have a function in the plant itself. It's actually protecting the plant from bacteria, from insects, and from fungi. And these lectins, they contain a molecule within it that's called phytohemagglutinin. Say that 10 times. Phytohemagglutinin. And this chemical or this compound, it's a protein, and what it causes the red blood cells and the white blood cells to clump together. Guys, red blood cells and white blood cells are not supposed to clump together. They're supposed to be individual. They're supposed to flow through the veins and arteries and get from one part to the other part of the body so that it's sending the right information that it needs to in those red blood cells and white blood cells. And so when you have cells that clump together, you're going to develop inflammation. You're going to develop disease. Because the word disease in itself says that there is no ease in the flow. There's no ease in the flow of these red blood cells. It causes stagnation. And we know just by looking at nature that a river flows. And when the river stops flowing, it becomes stagnant and you get all kinds of green, icky stuff that grow there, bacteria and fungi that grow there. So this is what lectins can cause in some people. And so we see that continuously in my practice. There's research on this, but I'm very, if my patient has this reaction and they stop these foods and they get better, that's enough evidence to me to see that these foods are causing these issues in people. So it can cause digestive issues. It can cause autoimmune flare-ups. Joint pain gets worse. Increased inflammation. It affects our immune system, once again, because the blood is not flowing properly, right? And so it's very interesting to me when I get someone who comes in for joint pain. We're talking diet, we're talking nutrition, and they're thinking, I thought you were just going to give me something right for my pain. Yeah, that's what your conventional doctor will do or other doctors will do. But as naturopathic doctors, we look at nutrition as the main place to start to help you with your pain. So I talk about these lectins, I talk about the nightshade foods, and I instruct them, eliminate them, give yourself, 3 weeks without these foods. And I want you to introduce one food at a time for 3 days and see what effects you have. And if you don't have any negative effects from that food, then we know it's okay for you to eat that and then move on to the next food. If you eat tomatoes and your joint pain increases or your symptoms increase, then we know that's a food that you have to avoid. And this is the way we test people to know, is this food good for you or not? It's a process. And it's like 10 out of 10 times, guys, my patients, when they stop the lectins, the nightshade foods, their pain is down. And so when they introduce foods one at a time, they will identify, I can't have tomatoes, or when I have bell peppers, this happens, or when I eat potatoes, this happens. And so we need to identify what those foods are causing in our body. Just so you know, red kidney beans do have, and white kidney beans have high levels of these phytohemagglutinin. And so in consuming these in high amounts, which I doubt many people are consuming these in high amounts, it can cause toxicity in the body. And so a fun tip that I want to share with you guys, because a lot of people ask me, why do we get gassy when we eat beans? And they're good for you, right? For the most part. Well, we have this enzyme called amylase, and amylase is found in our mouth, in our saliva, and our pancreas will secrete it. And amylase is used to break down and process carbohydrates. And so beans have this, they contain something called alpha amylase inhibitor. So it's inhibiting the amylase that we have in our mouth and in our pancreas to properly break down the carbohydrates from the beans, right? So because beans contain a complex sugar, this sugar is called oligosaccharides. That and the fiber content in beans make it difficult for our digestive system to properly digest it. So when the beans get to the large intestine, the bacteria that's in this area, it's going to break it down finally in the large intestine. And the byproduct of the breakdown is gas. So this is what causes the flatulence. So what I advise my patients to do before they consume beans, and I don't like buying canned beans. I'm Mexican, so we don't do canned beans. We make them ourselves. Is that any bean, whether it's lentils, white beans, black beans, kidney beans, white beans, that you soak the beans for 5 hours or more. You can leave them soaking overnight. You dump the water, you boil those beans in fresh water, and then I take it a step further. Once the water starts to get a coloring from the bean, and it's been boiling for a while, I'll dump that water out. I'll rinse the beans and I'll put fresh water, and I'll put a couple cloves of garlic and a small piece of ginger, because these things help to offset the gassiness. But by dumping the water and soaking them, what happens is that some of these oligosaccharides, these sugar molecules, are released in the water, and you're dumping them instead of you eating them. And I'll tell you, when I make beans, or my mom makes the beans this way, I can eat those. But anyone else's beans, forget it. It's not going to settle well with my digestive system. So try that to help reduce the gassiness, because there's a lot of benefits to consuming beans. So the next food that's really a food additive it's MSG. And MSG is the pure devil. It should be illegal to have in this country and to be added to our foods. You're going to find MSG in a lot of the processed foods, all these sauces, barbecue sauce, spaghetti sauce, all of those things. You want to take a look at in the ingredients list, because you're going to see that MSG is in there. A lot of restaurants will add it, and they add it to enhance the flavor to foods. It also makes it very addicting, so you want to eat more of it, and that's why they put it, so that you can go back and buy more and you can eat more again. But the effects of MSG, it's a neurotoxin, and it's been linked to obesity, metabolic disorders, and just so much more. So most of the time when people get rid of MSG in their diet and they accidentally have it, they're going to have a neurotoxin effect from that. So we're going to jump into a little bit about talking about inflammation and oxidative stress. So one thing that I want you to understand is that inflammation is a normal part of the body's response to injury and infection. There's always some level of inflammation occurring in our body that's natural, and it's okay. If you work out at the gym and you lift heavy weights, your body's going to have some inflammation, because it's the inflammation that recruits your immune system to go there and heal and repair that muscle to make it stronger. The problem with inflammation is when you have high levels of inflammation and it's constantly there. So this is what we call chronic inflammation. It's high and it's always there. And this type of inflammation will cause damage to healthy cells and healthy tissue, and we don't want to kill healthy cells and healthy tissue. Oxidative stress is another component that's a problem in our body. And the way I explain oxidative stress to my patients in simple layman terms is, imagine that old metal car that used to sit in someone's backyard and it was just getting rusty. Well, that rust is similar to oxidative stress. That rust on metal eats up and breaks down the metal. And oxidative stress does the same things to our cells and our tissue. And we absolutely don't want that to happen. So the best way to do it, to avoid having high levels of oxidative stress and inflammation, is that you avoid all those. Actually, there were 8 different foods that I mentioned, or categories of foods to avoid, because these are going to cause oxidative stress and inflammation. And to offset some of that oxidative stress, we want to consume foods that are high in antioxidants, because it's the antioxidant that's going to help reduce that oxidative stress and inflammation. So some examples of what an antioxidant are vitamin A, vitamin C, vitamin E, copper, zinc, selenium, things like that. But instead of consuming those as supplements, you should eat them as food. So the foods that you're going to find these in are your berries and strawberries. So any of the berry family, pecans, guess what? Dark chocolate too. Artichokes, spinach, kale, broccoli, avocado, onions, garlic, walnuts. All of these great foods are going to have that are going to be rich in antioxidants. So anything green, anything that has color, you want to eat those. Another thing that these foods have is called polyphenols and plant sterols. And these polyphenols and plant sterols, they protect the plants from UV sunlight and the environment that they're in, so it doesn't kill off the plant. So when we eat these foods and we eat them raw or lightly cooked, we're eating these polyphenols, and guess what they're doing? they're also protecting our cells and our tissue when we consume them. So, and the reason you want these antioxidants in there, like I said, it's going to protect your cells, but it's also going to protect you from cancer, from heart disease, from inflammation in your joints. It's going to protect your nervous system, your brain. It helps with anti-aging. And so this is why you want to consume these. I get often asked what causes oxidative stress. And like I said, a poor diet, smoking, drinking alcohol, exposure to environmental toxins. Some drug medications will cause oxidative stress. So the better your diet is, the healthier you are, the better these things are going to be lower, right? Oxidative stress and inflammation is low. So we're going to wrap this conversation up, and I just want to summarize those food categories to avoid: sugar, dairy, gluten, soy, corn, all the nightshade foods, which is the category, and foods that have MSG. So if you avoid these foods, you're going to feel better. And if you're interested in learning a little bit more about how to improve your health, and you're curious about working with me, go to my website. I'll put the link in this video. Go to my website and schedule a free 15-minute phone consultation. I offer these to learn a little bit about my patients before they come on board. I explain how I work with my clients. And if we have mutual interest of working together, we move on. I do work with patients via telemedicine, so that is an option as well. So if you found this information to be helpful for you and you took a lot of notes, please share this video with someone who can also highly benefit from these great tips when it comes to nutrition. Thank you for your time, guys, and until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.